diabetic ketoacidosis, hyperosmolar hyperglycemic state, and hypoglycemia should be considered in patients with altered mental status, especially with a history of diabetes. These conditions can lead to life-threatening metabolic disturbances and need immediate diagnosis and treatment to prevent serious complications. Patients presenting with profound hypotension or shock, especially in the context of infection, should be evaluated for adrenal insufficiency. Adrenal crisis can cause shock that is resistant to fluids and vasopressors, requiring prompt corticosteroid administration to reverse the condition. Severe hypothyroidism, or myxedema coma, is a medical emergency that requires immediate thyroid hormone replacement. Myxedema coma can result in multi-organ failure and death if not promptly treated with thyroid hormone and supportive care. Hyperkalemia in patients with metabolic acidosis requires prompt treatment with insulin, bicarbonate, and possibly dialysis. Severe hyperkalemia can cause fatal arrhythmias, and combined treatment lowers potassium levels and corrects the underlying acidosis. Hypoglycemia in non-diabetic patients can result from critical illness and requires immediate glucose correction. Even in non-diabetic patients, hypoglycemia can cause seizures, coma, or death if not treated quickly with glucose administration. Acute bleeding disorders should be considered in trauma patients with unexplained bleeding or bruising, necessitating a coagulation panel. Identifying coagulopathies early is essential for initiating targeted therapies to prevent worsening bleeding complications. Disseminated intravascular coagulation, DIC, should be suspected in patients with sepsis or trauma who present with abnormal clotting and bleeding. DIC is a critical condition involving both excessive clotting and bleeding, requiring immediate intervention to address the underlying cause. Hypercoagulable states should be suspected in patients with recurrent deep vein thrombosis or pulmonary embolism. Patients with recurrent clots may have an underlying clotting disorder, which requires long-term anticoagulation therapy to prevent further events. Patients with anemia and hypoxia require evaluation for underlying causes, including gastrointestinal bleeding or hemolysis. Addressing the root cause of anemia is necessary for managing oxygen delivery and preventing further deterioration. In splenectomy patients, be vigilant for overwhelming post-splenectomy infection, which can cause life-threatening sepsis. Overwhelming post-splenectomy infection can develop rapidly due to impaired immune function, and early recognition and treatment with antibiotics are essential for survival. Tumor lysis syndrome can occur after chemotherapy, resulting in severe electrolyte disturbances and acute renal failure. Tumor lysis releases large amounts of cellular contents into the bloodstream, which can overwhelm the kidneys and lead to dangerous electrolyte imbalances. Spinal cord compression due to metastatic cancer requires immediate steroids and urgent imaging. Steroids reduce swelling around the spinal cord, and timely imaging can guide interventions to prevent permanent neurological damage. Febrile neutropenia in cancer patients is a medical emergency requiring prompt antibiotics to prevent sepsis. Patients undergoing chemotherapy are at high risk of infection, and febrile neutropenia can quickly progress to life-threatening sepsis without immediate antibiotic therapy. Superior vena cava syndrome in cancer patients presents with swelling of the face and upper extremities and requires immediate evaluation. Obstruction of the superior vena cava by a tumor or clot can cause impaired blood flow, requiring urgent treatment to prevent further complications. Malignant pleural effusion can cause dyspnea in cancer patients, necessitating prompt drainage and management. The buildup of fluid around the lungs can severely impair breathing, and draining the fluid provides immediate symptomatic relief and improved respiratory function. Acetaminophen overdose requires prompt administration of N-acetylcysteine to prevent liver damage. N-acetylcysteine acts as an antidote to prevent or reverse acetaminophen-induced liver injury if given within a critical time window. Opiate overdose is managed with naloxone, with repeat doses as needed. Naloxone rapidly reverses life-threatening respiratory depression caused by opiate overdose, but multiple doses may be required depending on the drug involved.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.